Pancreatic cancer kills more seniors every year than colon cancer, and yet most people over 60 have never once been warned about its early warning signs. What makes this disease so particularly devastating is not that it can't be treated, it's that by the time most people find out they have it, treatment is no longer effective. The symptoms were there months earlier. They were real, they were specific, and they were dismissed as something ordinary. I'm Dr. William. Today I'm walking you through 8 symptoms this disease leaves behind while it is still beatable. Stay with me through all 8, especially number 5, which has a documented body count and almost never appears on any list a doctor hands a patient. Before we get into the symptoms, there's one thing you need to understand about why this particular cancer is so dangerous for seniors specifically. Your pancreas sits deep in your abdomen. It cannot be felt during a routine physical exam. Your annual blood work will not find this cancer until it has already spread. And most critically, the early symptoms are identical to things you have been told are part of normal aging. That is not a flaw in the diagnostic system. That is exactly how this disease survives long enough to become untreatable. It hides in plain sight. Here are the 8 signals it leaves behind while there is still time to act. Symptom 1. Dark urine that keeps coming back. Most seniors who notice dark urine do the same thing. They drink more water, the urine lightens for a day, and they assume the problem is resolved. That assumption has cost people their lives with this disease. Here is what is actually happening. Your pancreas sits directly beside a tube called the bile duct, which carries a substance called bilirubin from your liver into your intestines. Bilirubin is what gives urine its normal pale yellow color and stool its normal brown color. When a tumor develops in the part of the pancreas called the head, it presses against that bile duct, it compresses it, it blocks it. And when that blockage occurs, bilirubin cannot travel where it's supposed to go, so it backs up into the bloodstream, and your kidneys begin pushing it out through your urine. The result is urine that turns dark yellow, then brown, sometimes the color of strong tea or cola. The detail that separates this from ordinary dehydration is the pattern. You drink water, it lightens. The next day it's dark again because the blockage is still there. The tumor is still there. Water doesn't fix a tumor. This symptom typically appears before almost every other visible sign of this disease, and most seniors dismiss it several times before mentioning it to anyone. If your urine has been cycling between dark and normal for more than 2 weeks, regardless of how much fluid you're drinking, that is not a hydration issue. That is a conversation that needs to happen with your doctor this week, not next month. Symptom 2. Upper abdominal pain that radiates to the back. Your doctor may have already seen this symptom in you. They may have called it arthritis, a pulled muscle, an old injury flaring up, or acid reflux. And while you were treating the wrong diagnosis, this disease was buying itself more time. Pancreatic cancer pain has a specific signature. It begins as a dull, persistent ache in the upper abdomen, not the lower belly, not the sides, but directly below the breastbone or slightly to the left, and it doesn't stay localized. It travels. It wraps around the midsection and settles into the middle back, creating a sensation patients describe as a band being slowly tightened around the torso. This happens because the pancreas is surrounded by one of the densest nerve networks in the entire body. When a tumor grows into that tissue, it sends pain signals that radiate outward in every direction. 3 details separate this from ordinary back pain. First, it worsens within 30 to 60 minutes of eating a meal, not immediately, but predictably every time. Second, it becomes significantly worse when lying flat on your back. Many seniors with this symptom find themselves sleeping in a recliner or propped on several pillows without fully understanding why lying flat is unbearable. Third, it does not respond to the things that normally help. Ibuprofen, a heating pad, rest. The pain returns exactly the same way each time because you're treating the symptom, not the source. If this pattern is familiar to you, stop assuming it's your back. When you speak to your doctor, describe it precisely. Pain in the upper abdomen that radiates to the back, worsens after meals, and worsens when lying flat. Those 4 details together completely redirect a diagnosis. Symptom 3. Feeling full after just a few bites, you sit down to eat, Manage 2 or 3 bites and you're done. You push the plate away and tell yourself your appetite has changed. That is not your appetite. That is a tumor pressing against your stomach from the outside, physically compressing it, and your doctor likely has no idea it's happening because it was never mentioned. When a pancreatic tumor grows, it expands beyond the pancreas itself and pushes against surrounding organs. The stomach sits directly in front of the pancreas, and when a tumor presses against it from behind, it reduces the stomach's capacity. It fills up after a fraction of the food it normally holds. At the same time, the tumor is disrupting the pancreas's ability to produce digestive enzymes. Without those enzymes, food sits in the stomach undigested for far longer than it should. The stomach stays full. The brain receives a satiety signal. Appetite disappears. The consequence is unintentional weight loss that accelerates quickly. When the body isn't absorbing nutrients from the little food being consumed, it begins drawing on its own tissue for fuel. Unintentional weight loss of more than 5% of body weight over 2 to 3 months is one of the most serious warning signs in medicine. 10 or 15 pounds lost without any change in diet or activity is not an incidental benefit. It is a red flag that demands investigation. Feeling full after 3 bites is never just an appetite problem when it appears alongside other symptoms on this list. Symptom 4, yellowing of the skin or eyes. With unexplained itching, jaundice occurs when bilirubin backs up so significantly in the bloodstream that it begins depositing in body tissue. The skin takes on a yellowish tint. The whites of the eyes turn yellow. In seniors with darker skin tones, it shows most clearly in the eyes and in the palms of the hands. What almost nobody mentions is the itching. Intense, relentless itching across the body, with no rash, no visible cause, no relief from lotion or antihistamines, because bilirubin depositing in the skin directly irritates nerve endings. It doesn't ease until the underlying cause is addressed. Here's where misdiagnosis becomes especially common in seniors. Jaundice from pancreatic cancer looks identical to jaundice caused by gallstones. Same yellowing, same dark urine, same itching, because gallstones are extremely common in people over 60. This is precisely where investigations get redirected and delayed. Weeks pass, sometimes months. This is why walking into a doctor's office and saying, "My skin looks yellow," is not enough. You need to arrive with a complete picture. Dark urine returning repeatedly, upper abdominal pain radiating to the back, early satiety, and now skin or eye discoloration. That combination together tells an entirely different clinical story than any single symptom does alone. Symptom 5. An unexplained blood clot. This is the one that has put seniors in emergency rooms with life-threatening events before any doctor connected it to the pancreas. Think carefully about whether you or someone close to you has had a blood clot recently with no obvious explanation, no recent surgery, no long flight, no clear reason anyone could identify. Pancreatic cancer releases specific proteins into the bloodstream that fundamentally alter how blood behaves. It becomes abnormally prone to clotting in places and situations where it never should. The most common location is the deep veins of the legs. The calf or thigh swells, feels warm, and aches with a dull, heavy pressure that doesn't ease with rest or elevation. The life-threatening risk is what happens next. A portion of that clot can break away and travel through the bloodstream into the lungs. Sudden shortness of breath, sharp chest pain that worsens with breathing, a heart rate that spikes without cause. If those 3 things occur together, call emergency services immediately, not your doctor's office, not an urgent care clinic. Research has shown that in a significant number of pancreatic cancer patients, an unexplained blood clot was the very first sign that something was wrong, appearing up to 6 months before the cancer was ever diagnosed. 6 months earlier. That is how much lead time was available and was missed. If you have had an unexplained blood clot, ask your doctor directly whether abdominal imaging has been considered as a next step. It is a reasonable, responsible question. Symptom 6. Recurring low-grade fevers that cycle in and out. You had a fever last week. It went away, then it returned a few days later. You assumed it was something going around. It wasn't. A virus resolves. This pattern keeps returning because your immune system is not fighting something it can overcome. It is responding to a disease that isn't going anywhere. Pancreatic cancer generates persistent inflammation inside the body. The pancreas is inflamed. The bile duct is obstructed. Bile is backing up into areas it doesn't belong. The immune system responds to all of it simultaneously, producing a pattern of recurring low-grade fevers that cycle without ever fully resolving. These are not dramatic high fevers. They are episodes of feeling suddenly cold, chilled and shivering even in a warm room, followed within hours by a temperature of 99 or 100 Fahrenheit. Not high enough to feel acutely ill, but persistent enough to feel consistently wrong. When this cycling pattern appears alongside night sweats, waking up damp from perspiration without having felt hot before sleep, it is a combination that should trigger a deeper investigation. A fever that keeps returning over several weeks with no identifiable infection is not a recurring bug. It requires imaging, not another prescription. Symptom 7. Fatigue that rest doesn't fix. You slept 9 hours. You woke up exhausted. You assumed it was simply a bad night. It wasn't a sleep problem. It was your body being systematically deprived of fuel, not because you aren't eating enough, but because cancer cells are biologically programmed to intercept nutrients before healthy cells can access them. Normal fatigue has an identifiable cause and a reliable solution. Rest fixes it. Cancer-related fatigue doesn't respond to rest. You sleep 8 hours and wake up feeling as though you didn't sleep at all. You spend an afternoon resting and stand up feeling exactly as heavy as when you sat down. Tasks that were never demanding, walking to the mailbox, carrying groceries from the car, climbing one flight of stairs, begin to require effort that feels completely disproportionate to what you're actually doing. Pancreatic cancer cells compete directly with healthy cells for glucose and nutrients. While the body is trying to fuel the organs, muscles, and brain, the tumor is intercepting that fuel for its own growth. The body runs at a deficit every hour of every day. No amount of sleep compensates for fuel that is being stolen before it reaches where it needs to go. The resulting exhaustion has a different quality than ordinary tiredness, heavier, more total, and completely unresponsive to the things that normally help. If that description matches what you have been experiencing for several weeks, the cause deserves investigation, not acceptance. Asterisk, symptom 8, changes in stool, pale, greasy, floating, and foul smelling. This is the symptom I've seen in nearly every advanced stage patient I've treated. Every one of them had it. Everyone dismissed it as something related to what they'd eaten. Your pancreas produces enzymes specifically designed to break down dietary fat. When a tumor obstructs the pancreatic duct, those enzymes cannot reach the small intestine. The fat in food passes through the digestive system completely undigested, and that changes stool in very specific recognizable ways. It turns pale, gray or clay-colored instead of brown. It becomes greasy, with an oily sheen visible in the toilet bowl. It floats rather than sinks because of the undigested fat content, and the odor is distinctly worse than anything that could be attributed to diet alone. This is not a food reaction. It is a direct mechanical signal from your pancreas indicating that a tumor is blocking its ability to function. Alongside this, nausea after fatty or rich meals is common, as is a persistent feeling of fullness and abdominal heaviness after eating. And because the body is no longer absorbing dietary fat, it is also no longer absorbing the fat-soluble vitamins it needs, which accelerates weight loss, deepens fatigue, and compounds every other symptom on this list. Pale, greasy, floating stool that persists for more than 2 weeks warrants a call to your doctor within 24 hours. Not next week. Not at your next scheduled appointment. Tomorrow. What to do right now, asterisk, if you recognize 2 or more of these symptoms while watching this. The most important thing you can do is not wait. Write down every symptom you identified, the specific symptom, when it started, how frequently it occurs, and whether it has been getting worse. Then call your doctor and read that list to them out loud, exactly as written. Specific symptoms generate specific investigations. Vague descriptions of feeling off generate reassurance and little else. If you are sent home without imaging being ordered, you have every right to ask directly whether a CT scan or abdominal ultrasound is appropriate given what you've described. That is not being difficult. that is, being the most informed person in the room about what your body has been signaling, pancreatic cancer caught at stage 1 carries survival rates that are unrecognizable compared to stage 4. The only variable separating those two outcomes is what a person chose to do in the weeks after their body began sending signals. Most people waited. Most people decided it was aging. Don't make that decision with the information you now have. If this video gave you something your doctor has never mentioned, hit the like button and share it with someone whose back has been bothering them or who keeps saying they're fine. You might think you're forwarding a video. You might be giving someone a window they didn't know they had. I'm Dr. William. Subscribe if you're not already here, and stay for the next video because there is a specific combination of just 3 of these 8 symptoms that, when they appear together, almost confirms this diagnosis. And there is one test your doctor can order that catches it before it reaches stage 2. Most seniors have never heard of it. I'll cover it next.